let's talk about something important. Something that affects more people than you might think. It's a condition called hidradenitis suppurativa, or HS for short. I know that's a mouthful, so let's break it down. Think of HS as a long-term or chronic skin condition. It causes painful deep lumps to form under your skin. These aren't like the pimples you might get on your face. These are different. They tend to show up in specific areas of the body where skin rubs against skin. Armpits, groin area between the buttocks. Under the breasts, skin folds, sweat glands, and where friction is common. It's a condition that can be frustrating and confusing, but my goal here is to bring some clarity and let you know that understanding is the first step toward managing it. So, what's really happening under the skin? HS is an inflammatory disease. This means your body's immune system is getting a little overactive in certain places. It starts in your hair follicles, which are the tiny pockets in your skin where hair grows. For reasons we are still working to fully understand, these follicles can become blocked. When they get blocked, they can swell up, they can get inflamed, and sometimes even burst under the skin. This process is what leads to the painful bumps and other symptoms associated with HS. When we talk about the symptoms of HS, the first thing that comes to mind for most people is pain, and that's very real. The lumps that form can be incredibly tender and painful, even before you can see them clearly. These lumps often start as firm, pea-sized bumps under the skin. They can feel deep and sore to the touch. As they grow, they can become red, swollen, and filled with fluid, much like a boil or a cyst. Unlike a typical pimple that goes away in a few days, these lesions can stick around for weeks or even months. The pain isn't just a minor inconvenience, it can be severe enough to make simple movements, like walking or lifting your arms, very difficult. Another key feature of HS is what happens to these lumps over time. They can break open and drain a foul-smelling fluid, which is a mix of pus and blood. This drainage can be distressing and can stain clothing, adding another layer of difficulty to daily life. Over time, as these areas heal and flare up again and again, something else can happen. The body can form tunnels under the skin that connect the different lumps. These are called sinus tracts. These tunnels can also leak fluid and make it harder for the skin to heal properly. One of the biggest questions people have is, why did this happen to me? It's a natural question. While we don't have all the answers, research has pointed us towards several key risk factors. First and foremost, genetics plays a big role. About 1/3 of people with HS have a family member who also has the condition. This suggests that there are certain genes that can make a person more likely to develop it. If your mom, if your dad, if your sibling. This doesn't mean you're guaranteed to get it, but it does mean there's a hereditary link. It's something in your body's blueprint. Hormones also seem to be a major player. HS usually starts after puberty, and it's more common in women than in men. Many women report that their flare-ups get worse right before their menstrual period. The condition also tends to improve or even go away after menopause. These clues strongly suggest that our sex hormones, like estrogen and androgens, influence the activity of the hair follicles and glands involved in HS. Being overweight or obese is a significant risk factor. Extra body weight increases the number of skin folds, which leads to more skin-on-skin friction and moisture. Finally, smoking is another major risk factor. In fact, the vast majority of people with HS are current or former smokers, often work together, creating a perfect storm for HS to develop. To help doctors and patients understand the severity of HS, a staging system was developed called the Hurley staging system. Think of it as a roadmap that describes how the condition can progress over time. It's broken down into 3 stages. Knowing which stage you're in helps your doctor choose the most effective treatment plan for you. Hurley stage 1 is the mildest form of the disease. In this stage, you might have a single abscess, which is a painful swollen lump. However, at this stage, there are no sinus tracts, no tunnels under the skin. Hurley stage 2 is considered the moderate form. At this point, you're experiencing recurrent abscesses. The key difference from stage 1 is that you start to see sinus tracts forming. Hurley stage 3 is the most severe form of HS. In this stage, there are widespread abscesses and interconnected sinus tracts across an entire area of the body. There is significant, often painful scarring. Treatment at this stage is more aggressive and may involve powerful medications and surgical procedures. If you suspect you might have HS, getting a proper diagnosis is the most important next step. So how do doctors figure it out? Usually the diagnosis is made clinically. That means your doctor, ideally a dermatologist who specializes in skin conditions, will make the diagnosis by looking at your skin and talking with you. There isn't a single blood test or scan that can say with 100% certainty that you have HS. Instead, the doctor is like a detective, looking for a specific pattern of clues that all point toward this condition. Your doctor will look for 3 main criteria: typical lesions of HS, those deep, painful nodules, abscesses, sinus tracts. They will check the location of these lesions: armpits, groin, under the breasts. They will ask about the history of your symptoms. Have these lumps been coming back over and over again for a long time? If you meet these criteria, your doctor can be quite confident in diagnosing HS. Sometimes your doctor might do a few tests to rule out other conditions. They might take a swab of the fluid draining from a lump to check for a bacterial infection. Getting diagnosed as early as possible is so important. An early diagnosis means you can start treatment sooner. This can help reduce the severity of your flare-ups and prevent the condition from progressing. Once you have a diagnosis, the next question is, what can we do about it? The good news is that there are many treatment options available. The goal of treatment is to manage flare-ups, reduce pain, and prevent the disease from getting worse. We usually approach this with a multi-step plan, starting with lifestyle changes, moving on to medications and procedures as needed. Let's start with the foundational things you can do every day. If you smoke, creating a plan to quit is one of the most powerful steps you can take. If you are carrying extra weight, even a modest amount of weight loss can significantly reduce symptoms by decreasing skin friction and overall inflammation. Eating a balanced diet and avoiding certain trigger foods, dairy, sugary foods. Wearing loose-fitting, breathable clothing can reduce friction on sensitive areas. A gentle daily cleansing routine with an antiseptic wash can also help keep the areas clean and reduce the bacterial load on the skin. Next up are medications. For mild HS, topical treatments like antibiotic creams washes can be helpful. For more moderate to severe cases, your doctor might prescribe oral medications. These can include antibiotics, not necessarily to treat an infection, but for their anti-inflammatory properties. Hormonal therapies, like certain types of birth control pills, can be effective for some women. For more persistent disease, powerful anti-inflammatory and immune-suppressing drugs may be used. The most significant breakthrough in recent years has been the approval of biologic drugs, like adalimumab, also known as Humira, which specifically target and block a part of the immune system that causes inflammation. For advanced HS, especially early stage 3, surgery may be the best option. Procedures can range from something small, like draining a single painful abscess to provide immediate relief, to more extensive surgeries. This is a major surgery, but for many people with severe disease, it can be life-changing, offering a chance for a permanent cure in that specific area. HS is so much more than a skin disease. It's a condition that can have a profound impact on your emotional and mental health. Living with chronic pain, unpredictable flare-up symptoms that can be embarrassing is an enormous burden to carry. The pain itself can be draining, making it hard to concentrate, making it hard to sleep, making it hard to enjoy daily activities. The drainage and the odor can lead to intense self-consciousness and a fear of being found out by others. This can cause people to withdraw from social situations, avoid intimacy, isolate themselves from friends and family. This isolation can create a vicious cycle, making feelings of loneliness and sadness even worse. The visible scars, active lesions, can also take a heavy toll on self-esteem and body image. Our society places a lot of value on perfect skin. Living with a condition that marks the skin can make you feel flawed or unattractive. HS affects intimate areas of the body. It can make dating and relationships feel incredibly daunting. Many people with HS struggle with feelings of shame, anxiety, even depression. It's completely understandable. You're dealing with a lot, and it's okay to admit that it's hard. It's so important to recognize these emotional challenges and to seek support. You do not have to go through this alone. Talking to a therapist or counselor can be incredibly helpful. They can provide you with tools to cope with chronic pain, manage anxiety, rebuild your self-esteem. A mental health professional can offer a safe, non-judgmental space to talk about frustrations and fears you might not feel comfortable sharing with anyone else. Finding a community of other people who have HS can also be a game changer. There are many online support groups, patient advocacy organizations, where you can connect with others who truly understand. Sharing stories, tips, encouragement with people who get it can make you feel less alone. As we wrap up, I want to leave you with a message of hope and encouragement. I know that living with hidradenitis suppurativa is hard. It's a tough, relentless, often misunderstood disease. But I want you to know deep down that this condition is not your fault. It is not a reflection of your hygiene. It is not a reflection of your character. It is not a reflection of your worth as a person. It is a medical disease. It is a result of complex genetics, hormones, immune system responses. You did not ask for it, and you did nothing to deserve it. Please let go of any blame or shame you might be carrying. Remember, you are not alone on this journey. Millions of people around the world are walking a similar path. There is a growing community of patients. There is a growing community of doctors. There is a growing community of researchers who are dedicated to improving lives. We know more about this disease today than ever before. New treatments are on the horizon. Research is progressing and offering more hope for the future. Scientists are working hard to better understand the underlying causes of HS. That work will lead to more targeted and effective therapies. There is reason to be optimistic. The future of HS care is getting brighter every day. Your life can and will get better. Managing HS is a marathon, not a sprint. It takes time to find the right combination of treatments that work for you. But by working closely with your healthcare team, being proactive about your treatment, seeking support for your emotional well-being, you can regain a sense of control. You can reduce your pain. You can manage your symptoms. You can get back to doing the things you love. Your life is so much bigger than your diagnosis. HS is something you have. It is not who you are. Most of all, never lose hope. You are resilient. You are strong. You have the power to navigate this challenge.